Okay. Can you go to the chapter, the first chapter, which is called History of Medicine and Timeline? So I think this chapter I will leave it for you to read, to go over it. Okay? Is that okay? Yeah, because just it's like history.
Yeah.
Take have the time. Okay, learn the time and who is the person during that time and what did he do or what did she do. Okay, I will leave this one. It's more of a historical thing. There are some questions on the practice questions, because there are some questions about some history. So if it comes on the exam, it's possible. Okay, so it's better to go over it. And can you make a mark on it, and so that for you for self learning or self teaching. Okay. Okay, I will go to the third chapter on page 9 on patient care, and to law and ethics I will come back. Okay, I will come back to that part like later. Okay. Okay. Anything usually I will discuss it here on the board so that you can see it here on this. Okay. Okay, so what do we mean by a patient care? So, patient care is very important for what? For the medical assistant, yes? Not only for the medical assistant, but all healthcare personnel, they should what? They should know.
How to take vital
Yes.
signs.
So, the first thing I want to describe for you is that we classify healthcare professionals into like two kinds, okay? One are what we call the providers, and the second one are what we call allied health personnel. Okay, so we have these two kinds. Okay, that means healthcare providers are healthcare professionals.
Dr. P, can you order more of these? There's nothing. No more, please.
Okay. Who are the providers? Well, providers are the MDs, okay? Okay. The osteopath doctors, which are called ODs, okay? Nurse practitioners and physician assistants. Okay. So these four groups, they are called providers. That means these are who provide what? The health care for the patients, okay? And these are those who give like orders, like for example, prescription can be ordered by these people, okay? So it means you have to check if who is ordering that thing, okay? Any other person who is giving an order other than these four, then it should not be that we shouldn't like take it. Let's say if you get prescription or a lab test order. Okay, if an RN, for example, send you an order, maybe, okay, so the signature on the paper, okay, the RN may write it, but the signature should be of this person, okay. MDs, medical doctors, OD, they are called osteopath doctors, okay. NPs, nurse practitioners, PA are what? Physician assistants, okay. So MDs are usually those who work against the symptoms or against symptomatology of the patients. Okay. First, they check what? The symptom and signs. Let's say, okay, what does the patient has? The patient might have headache or fever. Okay. So that means they try to work against what? That symptom. Okay. First, they try to find what? The origin of that symptom. Where is the problem? Okay. Not only the problem, but the origin. That means For example, what is the cause of the fever? What do they need to do? Okay, you take vital sign, everything, physical examination, and laboratory tests. Okay, blood tests, urine tests, okay, lung, chest tests, all this will be done, and then finally you will get what? A diagnosis, and then you try to combat against those symptoms. Those that work like this, these are what we call the medicine. Okay, so they work more on drug treatment against symptoms using also surgeries. Osteopath doctors usually, okay, in addition to the surgeries and so on, and they also deal with what we call manipulation. So manipulation means by acting on the musculoskeletal system, by moving the musculoskeletal system, that means they try to alleviate or to reverse the symptomatology. Okay, these are called osteopath doctors. So NP these are masters of what? The RNs, yeah? They have masters in nursing. And PS are the physician assistants. Usually they work instead of the physician or the doctor in many places like in emergency and so on. So allied health professionals are all the other sales professionals, including medical assistants or phlebotomists or EKG technician, clinical technician, occupational technician or occupational therapist, okay? I mean physical therapist, okay? Medical technologists, medical what? Technologists. All these are what we call, they are classified under what? Under medical, under allied health personnel or under allied health professionals. Okay. So what does the medical assistant need to do? What are the jobs of the medical assistants? Who may try? Who may?
Take vital
Yes, take vital signs. Okay, that's one. Okay, yes, another thing.
The lobotomy,
Yes,
EKG?
also draw blood, do EKG. Yes, all of these are okay. So we can classify them as what we call administrative and clinical. Okay, so that means as an MA you do what? Administrative and